Hello, my name is Miss Brown, and I'm going to be the nurse practitioner taking care of you today. I'm going to be performing an HEENT and respiratory exam on patient X. Okay, so we're going to start off with the head. From observation, I don't see any lumps or bumps or anything. So I'm going to go in to palpate the scalp. Do you feel any pain or discomfort or tenderness? Hair distribution. Hair is just distributed evenly throughout the hair. I don't see any lesions. So now I'm going to come and I'm going to palpate your frontal sinuses. You're going to feel a little pressure. Let me know if you feel any pain or discomfort.
No.
Okay, so now I'm going to check the maxillary sinuses. I'm going to do the exact same thing. I'm going to palpate. Let me know if you feel any pain or discomfort.
No.
Okay, great. Alrighty, so now we're going to move on to the eyes. The first thing I'm going to do is I'm going to check the sclera. Can you lift your head up for me, please? Thank you. So I'm checking the sclera. The sclera is nice and pink. It looks moist. The lacrium, no discharge noted, no crusting. So now we're going to start with the visual acuity test. I'm going to use the Snell chart. I'm going to go 6 feet. He's going to read whatever line he can see. Read with the smallest line you see.
L T F P H.
Okay, patient X was able to see the 20/20 line with both eyes. Okay, so now we're gonna do the visual field test. I'm gonna wiggle my fingers behind your head. You're gonna look directly at me. You're gonna let me know when you start to see my fingers in your field of view, okay?
Okay.
Are you ready?
Yep.
All right.
Yes. Yes.
Okay. So now I want you to follow my finger with your eyes, not your head. Keep your head still. Move your eyes, okay?
Okay.
Ready?
Mm-hmm.
Okay. Keep looking at my finger. I'm going to move slowly into your nose, okay? Follow my finger. Okay. So now we're going to check his perla. So I'm going to shine a light into your eye. Look directly at me, okay? Pupil constricts, and they are consensual on both sides. Okay, sorry about that. So now I'm gonna check his eye for the optic disc. You're gonna look directly at me. I'm gonna move in nice and slowly to your eye, okay?
Okay.
Optic disc was visualized. I'm gonna do the exact same thing for the opposite eye. Optic disc was visualized. Okay, so now we're going to move on to the ears. From observations, the ears look symmetrical. I'm going to go and I'm going to check behind the back of the ear for any lesions or any lumps or bumps. I'm going to tug on the ear just a little bit. I'm going to palpate the tragus. You're going to tell me, do you feel any discomfort or pain or anything when I do that?
No.
Okay, I'm going to do the exact same thing on the opposite side. I'm checking behind the ear. No lesions, no lumps, no bumps. I'm going to pull on the ear a little. I'm going to palpate the tragus. Let me know if you feel any pain or discomfort when I do this.
No.
Okay, great. So now I'm going to look inside of the ear. Just hold your hand to the side. Thank you. Inside of the ear is nice and pink, no discharge noted. I'm going to do the exact same thing for the opposite ear. Inside of the ear is nice and pink. No discharge noted. I don't see any lumps or bumps or polyps in either ear. Okay, so now you're going to look at me. I want you to close your eyes, okay? Let me know if you hear this.
Yeah.
What ear?
Both.
Which ear?
Right.
Which ear?
Left.
Which ear?
Left.
Which ear?
Both.
Okay, great. So now we're going to do the Weber test. Do you hear it?
Yes.
Which ear?
Both.
Great. So now we're going to do the Renee's test. I'm going to apply this to the mastoid process. Let me know when you don't hear it anymore.
Don't. Don't.
I'm going to do the exact same thing to the opposite ear. I'm going to apply this to the mastoid process.
Don't. Don't.
Okay, so ear conduction is greater than bone conduction. So now we're going to move on. We're going to go to the nose. So now I'm going to observe the nose just from visually looking at the nose. The nose looks symmetrical. The nostrils, no lumps, no lesions are observed. So I'm going to look inside the nostrils to see what we got going on in here. I changed the probe. Okay, just lift your head back for me. Inside of that nostril is nice and pink and moist. No visual polyps. I'm going to do the same for the opposite side. Inside of the nose is nice and pink. There's no visual polyps or masses or lesions. So now we're going to move on to the mouth. So I'm going to need you to open up your mouth for me. Let me look inside. Stick your tongue out. Uvula is midline. Lift your tongue up. Up. Okay. Let me see the sides. Okay. So now we're going to check his gag reflex. So if you can just open up your mouth for me again. Perfect. Good gag reflex. Open up one more time. So the inside, the mucosa is very, very moist, nice and pink. Sides of the mouth looks really, really good. No lesions or anything. Okay, so now we're gonna move on to the lungs. So I'm gonna auscultate his lungs. Before we do the lungs, I'm gonna look at your throat. Lift your head up. Okay, so visually looking at the throat, I don't see any lumps. I'm gonna palpate it. I don't feel any lumps. Do you feel any pain or tenderness when I do this?
No.
Okay, great. So now I'm going to stand behind you and I'm going to put my hands around your neck. I'm going to need you to take a sip of this water, okay? Please sip it when I ask you and then swallow.
Okay.
Alrighty? May feel a little discomfort because I'm going to apply just a little bit of pressure, but I'll let you know when. Okay. You can take the sip. Swallow. Okay. Perfect. So, trach is not deviated. Thyroid is not enlarged. All right, so now we're gonna check your lungs, okay? I'm gonna ask you to take deep breaths in and out, nice and slow, not too fast. I don't want you to get dizzy, okay?
Okay.
Okay. Go. Okay, lungs are clear in all fields, anterior and posterior. So I'm going to just check his fingertips to make sure that there's no clubbing going on. Okay, so this concludes our video of the HEENT and respiratory exam. Thank you.